So you're considering a career in general practice? Hi, my name is Dr. Erwin Kwun. I'm a GP working in the UK. In this video, we're going to talk about the pros and cons of being a general practitioner. A career in general practice is very rewarding because you can use your knowledge and skill and make significant changes and practical changes in patients' life, and you can see the impact of what you're doing to the patient. It is also very challenging because of the enormous pressure on primary care and the increasing demand on primary care with an aging population and a limited number of general practitioners. There are pros and cons of being a GP. Let's talk about the advantages of being a GP. A major advantage of working in primary care is that it is easier to have a healthy lifestyle because you don't have to work unsocial hours. For example, you don't have to work night shifts as a general practitioner. Unlike hospital doctors who are rostered to work unsocial hours, working nights and working weekends frequently, as a general practitioner, you don't have this commitment. The vast majority of GPs don't work nights. Some GPs who choose to work nights may work in GP out of hours, but most GPs, they work during daytime. If you value your time and you want to have control over your weekend and your nights, then a career in general practice offers this flexibility where you can choose when you want to work, and if you don't want to work nights, then you don't have to do that. General practice is a family-friendly career. If you have a young family and wish to work less than full-time, this is very feasible. If you want to work from home, you can even work remotely as a GP. The second advantage of general practice is variety. You see a variety of cases in general practice, from babies to children, adolescents, adults to elderly patients. For example, today I saw a patient presenting with chest pain, shortness of breath, patient presenting with sore throat, ear pain, abdominal pain. So there's a variety of cases that keep things interesting, and if you enjoy variety, you'll never get bored in general practice. The third advantage is that you can advance your career and develop special interests if you choose to. There are many opportunities as a GP. So if you want to work as a GP with special interests in dermatology, in cardiology, in lifestyle medicine, or if you want to do odd shift in A&E because you enjoy the acute care, you can do that as well as a GP. You also have the option to develop your career. For example, if you want to develop your career as a salaried GP in a practice, then you can do that. If you want to freelance as a locum GP, you can do that. There's more flexibility. If you want to become a partner and join a practice where you have more responsibilities about the management and running of a practice, you can do that as well. The fourth advantage of general practice is that you're well compensated for your work. After only 3 years of training, you can qualify as a GP and your earning potential increases significantly. If you want to learn how much GPs earn, then you might want to watch a video where I do a breakdown of how much GPs earn, salaried GPs, locum GPs, and GP partners. Click the link down in the description below to watch this video. Now let's talk about some of the disadvantages of general practice. General practice is a challenging specialty because of the increased pressure on primary care. Primary care is in crisis because of a mismatch between demand and supply. The pandemic has created more challenges for GPs. The increase in volume and complexity of workload have caused experienced GPs to leave the profession by droves. As more GPs choose to retire early, this means more patients to take care of for GPs in the workforce. Access to GPs has become more difficult and patients are often dissatisfied. The limited resources available in primary care and enormous pressure mean GPs are more stressed and at risk of burnout. GPs are having to make more complex decisions and having to manage complex cases. Many GPs find it very difficult to manage uncertainty and having to take risk, and there's also risk of making mistakes and risk of litigation. When you're working in hospital, you have a team, and if you're having a patient who you're not sure about what it is, this problem, then you have ready access to investigation. Whereas in primary care, the access to investigation is not as you will find in a hospital setting. So general practitioners rely a lot on their clinical history, their assessment, and the clinical judgment. So this is something that you get better at as you gain more experience working and making decisions. One of the things that many GPs learn to do is to use time to actually help them to decide. So sometimes you might not know what a patient is presenting with, but you can rule out what are the problems, life-threatening condition or any serious pathology. But at the same time, you can use time to see how things develop, and you'll get a better picture with time. So this is something that you learn in GP training, and you'll get better with more experience. Another disadvantage of working in general practice is that you have a lot of paperwork. So you're having to action letters, a lot of discharge summaries or letters from specialists where you've been requested to arrange blood tests, to start treatment for patient requests, and these tasks need to be completed. And you also have to review blood tests or results of x-rays. So you have to find time to do these administration tasks on top of seeing patients in your clinic. If it's a busy practice where you have many patients who may not be able to come down to the surgery, then you may need to arrange home visits during your lunchtime or after your clinic. So if you're working in a practice where there's not many staff, where there's not many GPs, then as a GP it can be very difficult to work in such an environment where there's not enough support. So there may be struggles. You might find that working as a GP might not be easy. So if you're considering a career in general practice, it's important to think about the pros and cons of working as a GP. So if you're not sure whether GP is for you, this might be helpful for you to get an idea of what general practice is like. If you want to learn more about general practice, then you might want to watch this video where I take you through a day in the life of a GP. Watch the video to learn more about what it's like to actually work as a GP. Thank you for watching this video until the end. Take care everybody. Bye bye.